I'll turn to our superintendent for the superintendent's report.
Thank you, Mr. Chair. I have so many good things to share with you all this morning. And before I begin my formal presentation, I have a couple of special recognitions. So first of all, some of you may be aware that the teacher recruitment platform called TeachNC, which is part of a larger platform nationally called teach.org, has been run very well by Best NC for the past couple of years and has really seen some great data with its jobs board and helping to show potential teacher candidates where jobs are, how to apply, and we've seen some incredible numbers in its ability to attract teachers of color and just overall increase the number of teachers who are pursuing licensure and then pursuing applying for a job. The legislature in this past session moved TeachNC over to DPI and gave us a position to continue that good work. And so my team and I have envisioned that this position will not just manage the TeachNC platform, but will also be in a very cross-functional role working with Julie Pittman in the as the advisor to teacher engagement, with Tom Tomberlin in teacher recruitment and the work of Pepsi, and just really helping us connect the dots with teacher cadet programs, community college 2+2 programs, all the things that we are all through the Drive Task Force, through Strive, all of the work that's going on to fill our pipeline in a way that makes sense, that is equitable, and that leads to good outcomes. So with that, I am thrilled to announce that Dr. Jason Caldwell, who is here with us today, is starting today and taking on that position. So if you could stand, Jason. Welcome. Jason, I can't think of anyone more perfect for this role. Jason is a former orchestra teacher. He is a graduate of the Chapel Hill Carborough system, Miss Floyd, and lives in Greensboro now with his wife Leatrice, and he has an 8th grader named Ethan. We've been trading middle school horror stories this morning. And he is, not only was he an orchestra teacher, but he also has worked in a couple of different roles in helping adults come back into higher education. And he has worked extensively with community colleges in the past, and he also is adjunct at NC A&T, and so he's really just a true educator at heart. And so very excited about that. So thank you, Jason, and welcome. Next, I have the pleasure today of recognizing someone at DPI who has truly dedicated her entire career to supporting public schools of North Carolina. Not in the form of providing direct education to students, but from a perspective that is no less important. Lydia Prude has devoted her entire 32-year career to serving the financial staff of our public schools, the staff in the General Assembly and the state budget offices, as well as staff at DPI in the program divisions, all from a seat within the Division of School Business. Lydia, who is originally from Alabama, we won't hold that against you, was hired in May of 1990. Some of you in this room were not even alive yet. As an accountant within school business, and for the last 20 years has been the budget manager of the school budget and allotment section. Really, that which is an understated section of herself and 4 analysts that have the incredible responsibility of building and distributing the state's ever-increasingly complex $11 billion K-12 state education budget and $7 billion in federal grants. The accuracy and timeliness of allocating these state and federal funds to the over 320 public school units is not only imperative to the success of our public schools, but also for ensuring that the department has the confidence of the General Assembly and State Budget Office in our ability to manage these funds. During Lydia's tenure, the accuracy and reliability could have been taken for granted, for financial operations are only highlighted when an error is made. That may be why many listening today don't know who Lydia is, and she also has an aversion to the spotlight, I should point out, and why so many of us are not really aware of the impact that she's made over her last 32 years. But everyone in the field of North Carolina public school finance recognize her as the expert. And that kind of star power results in someone being referred to only by her first name. She is known as Lydia. Lydia has been an integral part of initiatives impacting funding over the last 3 decades and is revered for her historical knowledge. Not only what happened, but why. Patiently explaining the delicate balance of the funding formulas to many over the generations. These events include the Excellent Schools Act of 1997, the Excellent Public Schools Act of 2012, the development of formulas for low-wealth supplemental and disadvantaged student supplemental funding, the consolidation of state funds into 11 allotments in 1995, to the expansion to over 45 allotments today. The introduction, the expansion, retraction of funding flexibility, the start of charter schools, regional schools, lab schools, innovative school districts, cooperative innovative high schools, restart schools, and renewal school systems, all of which have a significant impact on budget and allocations. She has managed to steer the ship to accommodate whatever was presented to her from the budget bills over the year, even managing the years where there were no budget bills. Regardless of the problems presented to her, she has tackled them with professionalism, resiliency, and duty to the mission of public education. She has been the constant in the ever-changing environment of funding public schools, and the individual with financial leadership comes to for advice and consultation. A certain retired DPI chief financial officer, who I believe is with us today, stated that he cannot think of anyone who has had a more significant impact related to supporting public schools than Lydia. Lydia recognizes that DPI exists to support North Carolina's public schools, that her job is to listen and respond to the challenges of our LEAs and charter schools. She worked tirelessly to help them understand and receive the funding appropriated by the North Carolina General Assembly. She represents the very best of DPI employees and exemplifies the gold standard. Her support to the public school units during the challenging recent years was acknowledged by the North Carolina Association of School Business Officials at their conference, where she, along with other key members of the Division of School Business, were recognized with the NCASBO Star Award for dedication and support provided to the PSU financial staff. But a note from one LEA financial staff reflects the sentiments of those in the PSUs. Lydia has been a constant at NCDPI that we can count on for honest answers, quick turnaround, and she is always responsive. I really appreciate her steady, calm demeanor. I appreciate her answering questions for us again and again with patience and kindness. I know her job has always been difficult and stressful, some years more than others. I believe she believes in her work and in public education, and I admire that. She will be missed. So, although many today have never met this humble woman, anyone involved in public schools, from the General Assembly, central offices, teachers, teacher assistants, school nutrition personnel, to all our 1.5 million students, they have all been impacted by Lydia's work over the years. So, Alexis, I'm going to toss it to you.
Thank you, Superintendent Truitt. Lydia's just an incredible employee to work for, I feel like, because so much of you often see me at the podium, but really, like any leader that you always have that exceptional staff behind you. But today I wanted also to extend to have a couple minutes to extend my personal thanks, not just to Lydia, but also Kenneth, her husband, who has come with her today. As we all know, a spouse of a person who has such a huge responsibility like Lydia, the spouse also takes a portion of that responsibility on their shoulders. The stress, the burden, the many late nights and lost weekends. So I want to recognize Kenneth and thank him for his service to the public schools throughout the years and being here today. I also want to just extend my own personal thanks to Lydia for the 20 years that she's supported me and taught me so much about the public school budget, but specifically recognizing that she could have retired a few years ago. But instead, typical of Lydia's character, she hung in there through years of transition, staffing shortages, the pandemic, which was a significant hurdle for her and her staff, who are, many are here today, are here for Lydia. And so I will be forever grateful to her for that. And believe me, when I say that we would not be in such a strong position if she had decided to start her retirement when she could have. So I appreciate that. So in short, like many in this room today that have come not just within DPI, but also from other areas within state government that have been impacted by her work, I am a better professional for having worked with her during my career at DPI, but more importantly, I really am a better person. So I thank you, Lydia, and good wishes.
Come up, please. I'm so sorry to do this to you, but it has to be done. Come on up back here. Oh. Are we straight? Alexis. Let's do one more. Just one step. Yeah, perfect. Alan. Perfect. Alan. Just like that. Yeah, come on.
Well trained.
You could stand next to your wife.
Thank you. Thank you.
It has been truly, it's truly an honor to be recognized by such an esteemed board, Superintendent Truitt, and also DPI leadership. I have enjoyed working with everyone on the team here at DPI in my section, the school allotment section, as past and also present. So I just thank you so much.
All right. So it is an honor to come before you again this month with the superintendent's report. We are going to start with a very interesting visit that we had towards the end of February. So the team and I traveled to Fort Bragg. We were asked to come and meet with the recruiting office. So the person in charge of recruiting for the Army for the entire state is based at Fort Bragg. And we wanted to go and visit the base to find out what their needs are. What are the Army's needs? We obviously, the vast majority of people who are in the military are pursuing post-secondary credentials while they are in the military. They often have not necessarily received a college education yet, and many people enlist in the military immediately after high school. And so Fort Bragg, for those of you who don't know, is by population the largest military base we have in the U.S. And North Carolina has anywhere, depending on the year, anywhere between the third and fourth largest military population in the whole country. So this is, as a military spouse myself, this is something that I'm keenly aware of, both the benefits to be, my own husband received over $250,000 in free education from the military. And it presents an amazing opportunity for a lot of young people. And we're going to talk a little bit about that today. So, like many industries, we learned that the Army is having a difficult time recruiting, more difficult than usual. The Army, in fact, hiked bonuses to some recruits to $50,000 as the pandemic took a toll on recruitment options because they couldn't go to schools or public events to recruit. And we are seeing, I believe the numbers they shared with us are their target is about 65,000 new recruits per year nationwide, and they are down 10,000 recruits this year. So we talked to a lot of folks in the recruiting office who explained to us some very startling statistics. And this is something that I've been hearing now for a while, but you know, you never know if what you're hearing is anecdotal or actually true. But what they shared with us is that for every 10 students who come through the door of a recruiting office, 7 of them automatically disqualify for military service. Either because they are overweight, or it could be that they have gang tattoos, or a documented history of violent behavior. That's very startling to hear. Of the 3 applicants who do qualify, 1 to 2, statistically speaking, 1.5, are not able to pass the basic military entrance exam of the math and or the reading. This leaves us with about 1 to 1.5 candidates out of 10 who qualify for military service in the Army. there is a program that they can use to remediate, just like our community colleges do. They will remediate the third person, the 1 out of 3 who doesn't qualify for academic reasons. They have a remediation program that they said works about 40% of the time. Once they go to basic training, then at that point, they can do some kind of service selection where they can talk about what area of the military they might like to serve in. Would they like to be in IT, for example? Or do they want to be in artillery, something like that. And then they have to take a more rigorous test that will determine whether or not they have the aptitude, mainly in math, in order to go into the area that they would like to serve. Many students do not qualify for their first choice. And so they have another remediation program that has very good success with, called March to Success. And it was interesting to hear about why it might be that this particular program is more successful than their first point of contact when they were coming through the door. We can go on. We saw in our tour, we then were able to go to the base and tour a lot of the things that were going on. But this top left picture is an example of a lot of what I would call like simulation-based learning or project-based learning that they do with new recruits and with people who are coming to train. This picture in particular is part of it was like a movie set. It was absolutely incredible. So this is what you might find if you go into a terrorist cell, and they train them to know what to look for what stages a toxin might be in terms of weaponizing that toxin. So if you see this equipment, it means it's ready to go. If you see this equipment, it means they're halfway there to weaponizing the material. We saw a lot of, next slide please. We saw a lot of high-tech learning labs, a lot of CSI type of labs with having to do with law enforcement and explosives detection. But what was really interesting that we heard is that the Army does not have enough cyber experts and other kinds of IT experts. And that when we have people on the ground, they are heavily reliant on someone sitting behind a computer to give them the real-time data that they need. And then, of course, we've all, I'm sure, read stories about the amount of automation in the form of drones, for example, that the military is using. Rather than putting people in harm's way, they're using drones. But a lot of what we heard was wholly aligned to the work that we're doing with the Portrait of a Graduate. So they provide exceptional leadership training and are looking for people who have the aptitude to develop those durable skills that we've all been talking about. One thing that is important to note is that in addition to the GI Bill, which will pay for a 4-year residential college experience, while from the day that a student has gone through basic training, once they've completed basic training, they get $4,000 a year in addition to the GI Bill to pursue post-secondary credentials on the outside. So they could partner with any institution. Obviously, asynchronous online institutions are going to be the most appropriate for them. I remember when I was with WGU, we had people who were stationed overseas completing their undergraduate or graduate degrees. And so they will, anyone can receive $4,000 a year in order to pursue post-secondary credentials. So, of course, our now what moment is that if you recall workforce goal 3 and 4 that are listed here, we want to make sure, again, that students understand what enlisting in the military looks like. It is, it's not what it was 20 years ago even. But we also know from the data that our students are not academically or physically prepared to join the military. And so this is, again, all part of that conversation. I know, Lynn Moody always says, employed, enrolled, or enlisted. And again, it's not just college or career. It's college, career, or enlistment. Because this is an amazing pathway for many to economic prosperity. And again, with the option of being able to work on your education while you are serving so that you don't have to wait to use the GI Bill is just an incredible benefit for our young people who choose this option. Okay. So, the second thing I would like to bring to the board is the announcement late in February of the new Parent Advisory Commission. So, many states have a Parent Advisory Commission. This is not a new idea. Many states have Parent Advisory Commissions that have a larger group, but then also have different subsections. So there might be a parent advisory group that's specific to exceptional children, or one that is specific to career and technical education. So the purpose of this commission is to give parents a seat at the table, to elevate their voice in education. We know from lots of research and data that when parents are involved in their child's education, it cancels out other inequalities. So regardless of income, when a parent is involved in their child's education at a school, the student does better and the student benefits. And we want for parents to be able to lift up all of the amazing things that are happening in their children's schools. We want parents to, we all saw parents gain a new respect for teachers during the pandemic because they got to see firsthand what teachers were doing on a day-to-day basis, trying to flip that switch and educate students virtually. So while I cannot tell you at this moment exactly what this parent group will focus on in any specific way, because it will be their decision what they want to focus on, I have no doubt that it will be not dissimilar from other advisory groups that we have. We have a student advisory group, we have a principal advisory group, and we have a teacher advisory group. And they all meet regularly and receive information from the department about things that matter to them. And then we find a way to elevate their feedback. So the application launched on February 22nd. So the composition of the parent advisory board will be 2 traditional public school parents, 1 charter public school, 1 homeschool parent, 1 private school parent, and 1 at-large public school member from the largest county in each region. So that means in total, 4 out of 6 parents will be public school parents, while the other 2 will be non-public school parents. So, and then you can see those large regions listed right there. So applications will run through the end of March. The full commission will come together quarterly starting this summer. And then our goal is to have regional subgroups that will hold monthly meetings. And that there will be an in-person and a virtual option to accommodate parent schedules. And then if anyone is interested in seeing the application, the link is here. The application went out through to our public schools. The application went out through principals, and then we sent the application to a very well organized homeschool group, and then the application resides on the department's website as well. Then finally, we have with us our Student Advisory Committee. And this group was already in place when I took office, and so some of the members have experience serving with this group, and some of them are new. And so what I would like to do is just ask them to wave and be recognized, because I know they're kind of scattered throughout, but Bryn and Reagan, Carson, and Jalen, Kelsey, Amy, Willie, Ella, and Caroline. Thank you all so much. And I will tell you that last year, their problem of practice that they looked at is something that I know my own children were always interested in, and that is the idea that a teacher has the flexibility to excuse students from a final if they have met certain attendance requirements and have a certain grade in the class. But there's not consistency. Some teachers, one school may allow that policy, one may not. If the school allows the policy, one teacher may allow it, one may not. And these students were very concerned with that lack of consistency, and they actually drafted legislation to address this. So we look forward to sharing their new problem of practice in the near future. So thank you all for being here. And Mr. Chair, that concludes my report.
Thank you, Superintendent. I'll note one theme of your report is the importance of listening to those who receive our graduates as soldiers, sailors, or airmen, listening to parents who send us their most prized gift, and then students themselves. So I appreciate your highlighting the important leadership trait of listening. Questions for our superintendent, Ms. Kamnitz.
I do have one. Thank you, David. I love the idea of the parent advisory group. I think it's a gap. When you listen to the other groups that are already doing this, it's really important that we do this work. And I hope for it to be successful in meeting the goals that you've laid out here. I do have to express a little bit of concern about the makeup of the representation from each region. I feel that it does not match up with our mission, which is to provide a sound basic education to every student in North Carolina public schools. And based on what we just heard from you about what you're trying to accomplish, it seemed to be more focused on voices in our public schools. And yet, 2 out of the 6 from every county will not be part of that population. It will be people who have chosen not to be part of the public schools. So I would, it doesn't feel to me that it reflects the population that we serve as it is constructed right now. And so I just wanted to let you know that I hope maybe you'll rethink that or consider rethinking that. I think those voices are important. I think for the people who have made that choice, we have something to learn from them perhaps about why. But again, the proportionality of it makes me uncomfortable about your ability to accomplish what you want to do.
Yeah, thank you for that feedback. I think the proportionality is that 67% of the group will be made up of public school parents. So I think that's important to recognize. I would also say that there is a question on the application asking if what form of education are you currently using with your children, and what methods have you used in the past. And so it's very unusual that someone would be in a private or homeschool setting for their entire K-12 journey. Many families in North Carolina might begin in homeschool, but then family circumstances change, and so then that child attends a charter school, and then that charter school only goes until the 8th grade, and then that student attends a public high school. And what many superintendents will tell you is that that's a source of frustration for them because they haven't had the ability to educate that child all the way through. And so they have students coming to them with a very different education experience. And so for that reason, as you said, we do have something to learn from those parents. And what I would say is that we have districts and superintendents who view all children as being part of their community because they don't know when that child will become part of their school. And while this does not happen in all districts for many reasons, we do have districts where the local superintendents partner with homeschool families, and they partner with a private school in the community, or they partner with charter leaders. And I think that that is a model for how we should be invested in our children, because it's not the system of education that we're trying to protect. We want for this council to be about students. And as the chair just said, all students by law are in some form of education, whether it's homeschool, private school, or public school. And we're all here because we want our public schools to be the school of choice. But that's not always the case, which is why parent choice has taken such a prominent role, I would say even before the pandemic. So I so appreciate your candid feedback, but I feel very strongly that we do have something to learn from all parents. And I think it will be interesting to see on the applications. We've already received over 500 applications, by the way, which parents have at one point in time utilized a public school, but are no longer utilizing a public school. We also have families where a sibling attends a private school, but another sibling in the same family goes to public school. And so I think that they're all our kids, they're all our future, and I look forward to engaging with all parents.
And again, I agree that
Mr. Chair?
have a place at the table.
Be to you in just a minute. Ms. Kamnitz has the floor.
Sorry, I apologize, I should have.
Take your time.
Still, 2 out of 6 seems high to me, and I will share with you that I am hearing from parents in Pitt County who are very excited about this prospect, but also disturbed about what I've just expressed. So,
Thank you. Thank you.
Thank you, Ms. Kamnitz. Mr. Ford.
Thank you, Mr. Chair. Madam Superintendent, I have a couple of questions as well. Much like Ms. Kamnitz, I've expressed publicly that I support the notion of the idea of engaged parents and parent voice, et cetera. My question always remains which parents, and that's going to be guiding sort of the questions that I have. When we went through our planning and work session, we had some key questions that, we encouraged us to look through as we make decisions as a board, right? Equity-based questions. So who is most well-served by this policy? Who is least well-served? Why? Et cetera. What voices might be missing from the room? And so my concern is about the inclusion of all parents, particularly those who are least likely to have a voice in the system. And so my first question, and there's two, is I noticed that on the application there is a requirement for parents to have a letter of recommendation from either an elected official or school board member and an educator. My first question deals with what is the virtue of that, right? When we're talking about selecting the parents and the voices that we want at the table, what purpose does that serve in the selection process? And the second one is a procedural question. There doesn't seem to be a lot of information on who will be making the selections and based upon what. Who are the folks within DPI who will be selecting these parents? What is the criteria? Is there a rubric? Is there any sort of requirement or consideration of inclusion or diversity as a part of that process? And so those are the two questions that I have.
So thank you for your question. So your second question, the application asks some very specific questions about how parents view the role of public education specifically. And so that will ensure diverse viewpoints can be a part of this group. There is an internal committee at DPI, which I will be a part of. Those folks have been asked to serve on the selection committee. And when they have been confirmed, it's because it's quite frankly up to them if they want to serve on the committee or not. But once that group, I believe there are 10 people on the group, once they've been confirmed, we'll be happy to share those names. There will absolutely be geographic diversity on the group. In the group, we've not asked for race or ethnicity on the application. But to your other question about the virtue of asking for some kind of recommendation, we want to ensure that we have, first of all, that the person applying actually is a parent, and second of all, that they are wanting to be a part of this council for the right reasons. So if there are issues with the council once those names have been chosen, I'm happy to answer questions at that time. But it's premature to have concerns about who is on the committee when the application process hasn't even closed yet.
Mr. Duncan, Vice Chair Duncan.
Thank you, Chair Davis. I agree with what's already been said. To recognize the voice of parents is very important. So I appreciate that something's been thought through to have a recognition of the voices of parents. My concerns are that had we had a chance to talk about this beforehand, perhaps we might have had a different composition or approach for setting up the composition of the commission. I sometimes am held captive by my early math classes, and 78% of our kids are in traditional public schools, and the proportion of our traditional public schools children who are guaranteed to be on the commission is only 33%, because the largest county designation is from a public school. So that designation could come from either a charter school or a traditional public school. So it could be as low as a 33% representation for 78% of the students in the state. Somewhere around 8% of our kids, 8 or 9%, come from charter schools, which again are public schools and should be represented in I think everyone's view on a parents' commission dealing with the oversight of public schools. But no more than one would be close to proportional. You can't make it proportional without having even more members, and so, but more than one would be closer to, one would be close to proportional. But we could have two, the way it's currently set up. And then finally, we don't have jurisdiction over, in any meaningful way, over either private schools or homeschools. And I think there are vehicles to get input as to why people left the public schools, if that in fact was their choice, or in some cases never left, but have been in either private schools or homeschools the entirety of the educational career of their children. As you said, there are well-organized groups for both of those, and there's sources where we could certainly partner and liaison and get a better idea from those groups. But a 33% representation in the commission is out of over a group that we have no ultimate meaningful jurisdiction in this state. It does not strike me as hitting the right chord. So I want to circle back, because I believe stating the positive is always important. Parents' voices are important, and I'm glad we're looking at doing that. I wish we'd had a chance to talk about the composition a little more deeply before it's announced, because I know there are a lot of questions, and the members have reflected, and I've certainly got a very large number as well received from various sources. And so one other set of questions that came up, those were really comments, but one question that I'll leave you with. There's also been an email that's sent out that a number of people brought to my attention pretty quickly. And there was some concern expressed about that, as in, would that help or be beneficial to have been a recipient of the email in some way to perhaps get named on the council. So I think it's important to give you a chance to respond to that, because there has been some, well, I know there's public criticism about it in some quarters, and I think it's important for you to have an opportunity to respond to that. So I want to give you that chance.
Well, first of all, this board does many things and comments on many things over which it has no jurisdiction. So I don't agree with that argument. Also, I'm bringing this to the board as a courtesy, and in no way required to include the board in this work. With regard to the email to which you're referring, I think it's important to be clear that what we're talking about is an email that was sent out. As I said, the application was sent out en masse through principals, and the email that I believe you're referring to is an email that my campaign sent out, which is something that is completely a matter of course for all elected officials. There are absolutely no laws or any ethics standards that have been violated in sending out that email. In fact, I have an email in front of me right now that is from a fellow Council of State member and Democrat saying that chip in now to support my work to protect consumers across North Carolina. I will file lawsuits on your behalf against North Carolina's price gouging statute. So it is commonplace for elected officials to send out emails through their campaign that automatically have a donate button at the bottom of the page. So again, if people can insinuate whatever they want about whether or not this is a pay-to-play opportunity, until there is proof of that, I would say to not make such insinuations. And I would also say that if any superintendent has received that email, it's because they're on my campaign emailing list.
Any other questions? Ms. Floyd, excuse me, Ms. Clemens. Apologies.
Thank you. I have a few comments, and before I kind of ask the question or the main comment, I just want to echo all of the things that was said from what Ms. Camden shared about having some major concerns that as a public school entity, and as I look at your presentation, it talks about sharing the aspirations for public education and discussing those challenges, yet disproportionately our traditional public schools or our public schools are not represented in that. I also want to point out that, we around this table talk a lot about equity and our commitment to that, our commitment to diverse voices. However, that's not something, if we're committed to that, that's not something that we can do passively. We have to think ahead and be proactive in thinking about what are the voices that are marginalized. We have to think about who those people are, and we have to make sure to create something and design something that's going to get those voices at the table. And so the lack of thinking about race, ethnicity, and other dimensions of diversity is problematic. And so I just encourage, I know Superintendent Truitt, you said that it was a courtesy to bring this about to the board. However, I think one of the things that we stand on is that, we use our feedback to create something better. And so I've heard a lot of pushback and in this room as well as in the public about the composition of this Parent Advisory Commission. And then I challenge you and urge you to really think about other dimensions of diversity when composing this group so that we all together can come up with the best way to go about this. Thank you.
Yeah, and I thank you for the feedback. And I would add that the application was also sent to our migrant population liaisons, our homeless population liaisons, our EC audiences. There's all kinds of diversity, and again, happy to address concerns from the board if the board takes an issue with lack of diversity once the council has been established.
Okay, thank you. We will now move on to our regular update from our North Carolina Department of Health and Human Services partners. And I'll turn to Dr. Betsy Tilson for this report. Dr. Tilson, welcome.
Thank you very much. I appreciate being with you all as we are every month. I see that our slides are up, so let's get right into it, and really happy to be able to bring really overall very good news across many of our metrics, our guidance policy. We are in just a much, much better place. So really happy to bring good news all around to our states, to our schools, to all of our people. I'll just go over some of our, as usually do, some of our regular trends. Also, I'll add in some data that was requested last month, going in a little bit more into some of our hospitalization data and also some of our overall immunity data, which is really good news and really has been one of the informing pieces to us as we think about shifts in our policy. So there'll be some new data this month I'm happy to share with you. And then we have had two very significant policy updates in the Strong Schools Toolkit since last we met last month. One policy that went into effect already and one that will go into effect soon. And so wanted to be sure that the board is aware of those changes in the toolkit for consideration for endorsement. So next slide, please. And then you can go ahead and do the next slide. Terrific. Okay, so again, I hope that you're used to our 4 key metrics. And thankfully, all 4 of our key metrics continue to decrease rapidly and steeply and consistently. So we are very happy to see that. Again, on our left-hand side, it looks at our number of lab diagnosed cases. When we couple that with the percent of our tests that are positive. This is data from Tuesday when we submitted the slides for you all, and I'm happy to say that those trends are continuing to decrease. And on the right-hand side, it looks more at the burden, clinical severity, such that people are needing to seek hospital care. The top right is people who are seeking the emergency department for care, and that kind of amber red line is this year, and you can see now it is actually a little bit below where we were last year, which is terrific. And then our hospitalizations continue to decrease as well. One thing I will say was that these have been our 4 key metrics that we've been using. However, these metrics will probably not serve us great as we're moving forward, especially for things like the percent positive, since we know so many people are now doing home-based tests, that percent positive is likely no longer as important of a metric, and also thinking through more of leaning in more on burden, on more severe disease, on hospitalization. So know that we are rethinking and retooling what will be our key metrics going forward, and you'll likely be seeing some changes over the next, within the next month of what are better metrics as we look forward. But these key metrics have served us very well to this point. We continue to see great trends, and just know we're being proactive and thinking about what metrics will help us in this next phase of the pandemic. So just a little preview. Terrific. And then, as we always do, just breaking out these case rates by age, really thinking through how is this impacting all of our ages, including our pediatric population. And you can see steep decrease across all of our age population, including our 0 to 7, represented that yellow line, really nice steep decrease. On the next slide, we break out our within our pediatric population. And again, steep decrease across all of our pediatric populations. In the past, we've had maybe our high schoolers having a little bit of higher case rates, but they've all decreased. The other really good piece of news is we've always tracked our data along our around race ethnicity line, really paying attention to the equity up front. I'm very happy to report that now we've had not even a lessening, but basically an elimination of the disparities of our case rates amongst our African American population and our white population. And what had been incredibly persistent was a higher case rate amongst our Latinx population. That disparity has also disappeared as well. So everybody across the state is benefiting from these lower case rates. So we're really happy to see that data. Next slide, please. This looks at our educational clusters. Again, those clusters in our K-12 schools are represented in the green, and you can see a decrease in our clusters that is tracking the decrease in all of our cases. So we're happy to see all of those metrics all going in the right direction, which is terrific. On the next slide, here's a couple pieces of some new data that just highlight some of the data we have on hospitalizations. As a reminder, this is all on our publicly accessible dashboard. I put the link there, and you can break down our hospital data by race, ethnicity, and also by age. I have highlighted age here as this was a request. The way we get our data from hospitals are new admits, and then we have broken down by demographics in our new admits. A new admission. So that's what you see here. On the left-hand side, you see trending of our new admissions and a breakdown of the age. And then for every day, we have a snapshot of the most recent one. And so in general, the percent of our new admissions that are for our pediatric population, 0 to 17, ranges from about 2% to about 6%, depending on the day. You'll see back in January where that dark blue was a little bit bigger. That was about 6%. So somewhere between 2 to 6% of our new admissions are for children. Then you can see the breakdown of admission by different age groups more granularly. On the next slide, we also, and this is all raw data that you can download as well if people are very interested, but also looking at just trends of new admissions, specifically for our children, 0 to 17. You can see back in January, that was last year's surge. And then you can see that Delta surge in August. And then you can see the Omicron surge, the most recent ones to the right-hand side in the hospitalizations for children. On the next slide, just to bring attention, there was, what I shared with you was North Carolina data, but there was also an article recently published that looked at trends in hospitalizations for children and adolescents. It was a multi-state study that was able to pull data from hospitals across the country. So across the country, what we saw was increasing hospitalizations and hospitalization rates for our children and adolescents associated with Omicron, and seeing a much higher peak during our Omicron than for Delta. And so there was about 4 times higher rate of hospitalizations for children during the Omicron peak than during the Delta peak. Also looking at the protective effect of vaccines for our adolescents and overall found that the hospitalization rate for adolescents who were not vaccinated was 6 times higher than for adolescents who were vaccinated. So again, continuing to see that protective effects of vaccine for to decrease severity of illness, hospitalization. The other one I wanted to point out is this was asked last month when we were talking about hospitalizations was, is it with or for? And then as I did describe, sometimes it's a little bit hard to tease out because someone may be admitted for a primary diagnosis of COVID, or it may be their underlying medical condition is being exacerbated by their COVID. And so sometimes it's a little bit hard to tease out. But this study tried to do that. And the large majority of these people were had COVID-related symptoms at admission, 87%, and that 81% COVID was their primary reason for admission. So the vast majority of these admissions were for COVID and not incidental. They were there for another reason and just incidentally picked up. The other piece I wanted to bring with you, and again, this is also on our dashboard, just thinking about other longer-term complications with children, is our multisystem inflammatory syndrome in children. This is, again, is available on our dashboard, and you can see those kind of peaks in the MISC that follow the peaks in cases. This is a lagging indicator. MISC tends to happen about 3 to 4 weeks or so after an initial infection. So we may well still see some increases in our MISC secondary to the Omicron surge. Now, the overall rates and proportion of children that have MISC is very low. You'll see those numbers aren't huge, but just wanted to be sure I was sharing some of those trends. That'll be something that we'll be following as well. Now, some really, really good news. I'm really excited to be able to bring this to you. And this is also part of the piece as we're thinking through policy changes and part of the context and the landscape across the country and across North Carolina that we're able to bring in to inform some of our policy changes. So wanted to bring you some data that looks at some estimates of immunity across the state, and we are having increasing levels of immunity, which is really good. On the next slide, don't move to that yet, I will talk about that. It doesn't mean absolute protection, but the more and more, at least even partial immunity you have across your population, that is a really good thing, and then overall lowers the risk for your population. So let me just share with you 3 pieces of data. The first one is an article that was recently published. North Carolina data is in there whenever epidemiologist is a co-author. But it looked at, we've always known, and we have articulated that our lab-confirmed cases, we knew were always an undercount of our total cases. Many people who don't get tested, especially those who may be asymptomatic or mild. So we always knew our lab-confirmed cases was an undercount. This study sought to quantify that a little bit more to give us kind of a rough idea of how many more people may have actually been infected across the state. Now, this is data that's a little bit old. The publication was recently published, but looks at data a little bit old back in May of 2021. Because of, with Omicron, thankfully, so much more of the disease has been mild and asymptomatic, the undercount may be even higher. But at least for the time period through May 21st, overall looked that in our population, there was likely 2.5 times more cases than reported cases. So that was that ratio of reported cases to people who had evidence of past infection. And then when it was broken down by age population, that ratio is actually even higher amongst our children, most likely again, because they typically have had mild disease and may not have been tested, but likely that only 1 in every 5 cases of children may have been reported. So may have had more cases and therefore some more partial immunity in our pediatric population proportional to our adult population. The other 2 data points, these are publicly available data that are on the CDC dashboard that looks at seroprevalence nationally and also broken down state by state. The middle one looks at blood from blood donations, so from our blood banks, and looks at blood from blood donations. This is only for people 16 and up because it comes from our blood donation, and it looks at a combination. It looks at antibodies in the blood that would be from either past infection or vaccination. So they look at those two sources of antibodies. Overall, and this is really good news, overall, about 95% of people whose blood was sampled this way had evidence of antibodies, again, either by vaccine or past infection. And when you look at North Carolina, 94.3% of people in North Carolina also had evidence of some past immunity. That is terrific. On the right-hand side, you can see the estimate of what kind of immunity. The dark blue is that evidence of immunity from past infection, and then that light blue is a combination of past infection and vaccine. So more of our people have evidence of immunity from vaccine than past infection, but pretty darn high rates amongst our adult population, which is terrific. The other data point we have that now incorporates children, because the children aren't included in the blood donation data, but it looks at data from our commercial labs. This is blood that was drawn for non-COVID reasons, anonymous blood, but looks at evidence of antibodies specific to post-infection. So this is just the post-infection piece of immunity. And you can look in North Carolina, about 40% of blood samples showed evidence of past infection. And you can look at the rate of that is higher the younger you are. So amongst our pediatric population, more than 52.5% of our pediatric population have evidence of past infection. And you can see that rate gets lower the older you get, but the rates of our vaccination gets higher the older you get. So that gives us some really nice information that we have more and more overall immunity in the community, as we say. Next slide. Just want to do a little bit of some caveats, especially with some of the data around post-infection immunity. And this is discussion that we've had in the past, but I just want to emphasize that although there is evidence of antibody, that does not mean 100% protection from future infections. And so just thinking through how to interpret this data as we think about it going forward. So one, antibody levels are associated with protection in the community. So the fact that we have an increasing rate of overall immunity in the community is a really good thing at a population level, allows us to be able to ease up on some of our public health recommendations. But just want to warn that what we see in a population, we can't translate to an actual individual and then predict that that individual will have protection from future infections. So it's just a little bit of a limitation of applying this data to the individual level. We do, though, know that people who've had post-infection do have some level of protection for future infections and future severity, which is great. The data really shows that it's most strong after 3 months of your infection, really very, very low risk of reinfection, and likely robust protection even up to 6 months after that initial infection. After that, though, the strength and the consistency of that protection is pretty heterogeneous. The other piece that's really important is that it looks at your amount of protection from a past infection may well be associated with how severe your initial infection was. So people with more severe infections may be afforded more protection for future infections. And so when we think about this, especially with our children, and we've been talking over and over again, most of our children have mild or asymptomatic disease. So if your level of protection is associated with a severity of disease, if you have a mild disease, it may be that protection for future infections is decreased. It's also, nobody knows what quantifiable level of antibodies in your blood, i.e. your blood test for antibodies, then can be used to say, yes, you have protection for future infection. We do not have that knowledge to be able to predict that. And we do know that overall our protection for vaccines is more quantifiable, more studyable, more homogeneous. And the data that continues to come out is probably the best protection is someone who's had a past infection and vaccination stimulates different parts of the immune system and have really some of the strongest and most robust protection going forward. So just a little bit about immunity. Great. All right, let's talk now more about vaccines, where we are, continuing to have good news. This, again, data was on Tuesday, and we bumped up a percentage point in our 18 and up yesterday, up to 76%. So though our rates of vaccines are slowing, we are still making progress and still increasing. So overall, everybody who is eligible for vaccine, that's people 5 and up, almost 70% of those people have had at least one dose. You can see a breakdown on the bottom, more granular. About 26% of our 5 to 11-year-olds, about 48% of our adolescents have had at least one dose. Also wanting to be sure that people are working on getting their booster, knowing the data is showing the real importance of boosters, that the protection for those first 2 doses does wane, and so very important to get that booster, and so we're focusing on that as well, and have very high rates of boosters amongst our older population and working on our other populations as well. Next slide, please. And just a little bit more about our pediatric vaccinations. What we do know, and we're hearing time and time again, is that for parents, their trusted medical provider, if they have one, is that best source of information for them. That's where they want to go. That's where we want to have the questions answered that they really want to talk with and get vaccinated through their trusted healthcare provider. So we've been doing a lot of work in ensuring that our primary care providers are part of our vaccination program and actively recruiting. We have more than 1,000 of our primary care providers across the state who are active COVID vaccinators. And so really want to be sure parents have access to a trusted medical home to have their questions answered and get that vaccinated in a trusted place. Also on the left-hand side, continue to show that North Carolina does outperform the rest of the Southeast in the United States, and we have higher vaccination rates amongst our pediatric population in our Southeast states. So we're happy to see that. And then just a little bit of an update, some of you may have heard, but the FDA there was a little bit of a stall on thinking about potential authorization for vaccines for our 6-month to 4-year-olds, so our pre-K folks. But the FDA is expected to review data for that younger age group likely in April. And that age group may be needing a 3-dose series as opposed to a 2-dose series, but we will see. There'll be new updated data, and the FDA will review that in April, and we'll see what comes out of that data review. All right, and then again, just some updated data. This is also on our surveillance report on our dashboard if you want to look along, but continuing to look at good protection of our vaccination for more severe disease, including hospitalizations and ICU admissions, with the majority of our hospitalizations in ICU are people who are unvaccinated, that vaccinated without booster, giving you good protection, but the best protection is vaccinated with boosters. Okay. So how this all translates into our policy updates and our changes to the K-12 toolkit. And again, we're in a very, very different context now with many, many enabling factors, contextual changes, again, higher levels of immunity, access for almost everybody to effective vaccines, especially preventing severe illness. So our landscape is shifting greatly. Also, what is shifting is how our variants are acting. And so I think what we talked about last week was with Omicron being so transmissible, moving so quickly, and having a shorter period of contagiousness most contagious right around when you get the infection, shorter incubation period for passing it along. And also more mild and asymptomatic disease, meaning people may not have gotten tested, didn't even know they were positive at a time that they may well have been transmitting it. So because of a lot of the changes, specifically in the Omicron variant, the effectiveness of our very intensive contact tracing and then notification and then exclusion of those notified contacts, the ability of that very intensive process, which worked well prior to the pandemic when we had variants that weren't quite as transmissible, weren't quite so mild, that public health tool is less effective when you have a variant like Omicron, where your window to intervene is very small. And so with that change in that variant, we made a shift in our contact tracing priorities, still emphasize contact tracing in high-risk settings, places like nursing homes, long-term care settings, where you have a better chance to decrease transmission, but really moved away from that contact tracing in our lower risk setting, our more general public setting, including our schools, where our ability to intervene and for that contact tracing to really change that rate of transmission is quite less effective. So therefore, on the next slide, effective February 21st, so this has already been in effect, that we now no longer recommend universal contact tracing and exclusion of those identified contacts, which was likely a subset of the overall contacts, that we no longer recommend that contact tracing exclusion in schools and other low-risk settings. Now, we do recommend that there still should be a notification for parents. We think it is very important that parents are aware. There may have been a case in their class, in their group, in their school, so notification, we still recommend that. And then people who are notified of a potential exposure, the recommendation is still that those people wear a mask for 10 days, unless an exemption to face covering applies. Also, recommendation that they should be tested immediately if they're symptomatic, or tested 5 days after notification of that potential exposure. So moving to recommendations rather than requirements for exclusions. So that was we were very happy to be able to make that change, very consistent with many of our national public health associations, and actually very consistent with CDC as well in their new updates. So that's already in effect as of February 21st. And then we're very excited. This is what we were able to announce a couple weeks ago, hoping that our trends, or anticipating, I should say, that our trends would continue. But that if our trends continue, that we are very happy to say that we feel very comfortable being able to make changes in our mask recommendations. Again, everything that I was just talking about in all those prior decks, our landscape is very, very, very different. And we have a much wider array of effective tools to reduce risk. Our trends are all decreasing, and we really want to continue to tailor our response to the pandemic to those tools that are most effective and most tailored to decreasing our risk. And so therefore, that universal mask mandate, we feel, because of all these other contextual changes, is a less important tool now to lower risk in schools. And so on the next slide, you'll see then wording that is in our updated toolkit that will be effective March 7th, that North Carolina DHHS no longer recommends, I apologize for a typo, no longer recommends universal mask requirements in schools or other low-risk settings. The other change that happened on Friday was that CDC also dropped their mandate for wearing masks on public transportation, school public transportation. That lapsed as well. So we no longer recommend universal mask requirements. However, we still do recommend that people who are at higher risk for severe disease continue to wear a mask, but this is more on an individual level. So we want to be sure people have the information and tools they need to then make individual decisions for themselves. So we still recommend students and staff at high risk for severe disease, or who are not vaccinated or up to date on their vaccines, wear a mask. Still recommend people wear a mask following an exposure, as we just talked about. Still, people who have an infection with COVID-19 wear a mask for those 10 days after exposure. And then anybody who wants an added layer of protection should be able to wear a mask and be supported if they choose to wear a mask. So that is my last slide with some, again, really good news from all of our metrics. All of our context allows us to make these pretty significant policy changes because we're just in a much different place in the pandemic. And I'm very excited that we are here and we're able to make these changes. So I will stop with that and happy to take questions that you all may have.
Dr. Tilson, thank you for this report. I remind my colleagues that the revised toolkit is on our action agenda for later in this meeting. Any questions for our partner, Dr. Tilson? Hearing none, thank you so much. Appreciate the partnership, and we look forward to continuing to work with you.
Wonderful. Thank you so much. I really appreciate it and all the work you all do.
Okay. We're running slightly ahead, so we're going to keep moving and begin our Committee reports. Remind committee chairs in the audience that all voting on consent and any item requiring action will be done at the end of the meeting via roll call. We're going to make a slight change in the order of the committees, and we'll begin with the Student Learning and Achievement Committee, chaired by Ms. Jill Kamnitz. Ms. Kamnitz.
Thank you, Chair Davis. The SLA committee started with an item of new business, which was Read to Achieve update on cohort 3 meetings and middle of the year assessments. It began with an update on the progress of the 3 letters cohorts, and we heard much to celebrate there. To date, almost 26,000 teachers and administrators across the state are involved in some stage of the letters training, and the final cohort, cohort 3, is preparing to add their numbers as they get their sessions scheduled for the beginning of their entry to the program. The complexity of this training is added to the demands placed on our teachers, but feedback from teachers and administrators that Ms. Ryan shared with us was very positive and very optimistic about the effect it will have on their students, which is what it's all about. It's anticipated that we will perhaps see some increases in student growth even before the effects are seen in overall proficiency and student outcomes. But we were cautioned to be patient with this work because it is not something that's going to happen overnight. It will take a few years for the full effects to be seen, and in fact the evaluation plan that is part of this program reflects that, because the focus in the beginning is going to be on teacher knowledge, and only several years in will we be seriously looking at the student outcomes that are resulting. We heard about the local, regional, and state support systems that will bolster and sustain this training for teachers. And we also received an overview of the middle of the year reading assessment data. Some good news: for each grade, K through 3, the percent of students at or above the benchmark increased, and with the exception of grade 3, the percent of students at well below the benchmark decreased. So there is movement in the right direction. We also looked at data comparing North Carolina performance with national performance, including demographic breakdowns by grade level. Many gaps still remain, but again, we are making some progress in narrowing those gaps. One part of the update was that each LEA is developing a literacy plan, and at this point, all but 6 of those have been submitted to DPI for review. So things are going exactly as planned, but it's a huge amount of work. Action on first read, we started with SLA 1, which is textbook commission recommendations for 9-12 mathematics and CTE. It was helpful for me, and I think probably for others, to review the definition of a textbook, because I think often, at least for me, I think about it as a hardbound book. It is not necessarily. It is defined as a systematically organized material, comprehensive enough to cover the primary objectives in the standard course of study for a grade or course. It can be print or non-print. The North Carolina Textbook Commission selected math and CTE teachers from across the state as content reviewers of the textbooks submitted through the 2021 bid process. After their input, the commission met in January to finalize the recommendations that we will vote on today. SLA 2 is an invitation to submit textbooks for evaluation and adoption for K-12 English language development and K-12 social studies. Our vote today will initiate the same process of textbook selection that is coming to a close through SLA 1. Beginning with notifying publishers of the opportunity to submit, the recommendation includes content evaluation criteria, which was developed by the Academic Standards and Exceptional Children's Divisions. SLA 3 is a report to the JLEOC on the 2021 third grade Read to Achieve Teacher Bonus Program. The report covers bonuses awarded in January 2019 and 2020 based on 2017-18 and 2018-19 data respectively. Bonus pay for qualifying teachers is based on the EVOS Student Growth Index score for third grade reading from the previous year. The report is also required to include information on the effect of these bonuses on teacher performance and retention. some of the findings showed that the distribution of bonuses across the state was not even, and that I think is reason for concern for all of us. Although there was a relationship between the bonuses and performance and retention in several areas, but not a clear causation. So it is difficult to draw conclusions from that data. And perhaps as this program has a few more years, some longitudinal data might be able to give a clearer picture of those relationships. We have 4 action items. SLA 4 is the Essa update. We have talked about this several times over the last few months on the need for this 1-year addendum to our Essa plan. It includes a 2-year timeline shift in our interim progress reports toward our long-term goals, an adjustment of the ACT minimum score, and adjustments to the identification and exit of CSI and TSI. These are targeted improvement schools. So the identification and exit of those schools has been adjusted to reflect the realities of COVID. An amendment will be coming to us we're going to explore the possibility of an amendment to address problems with the 95% testing requirement for high schools. SLA 5 is an State Board of Education policy amendment, state graduation requirements. As we discussed last month, this change in policy reflects the legislative requirements that students who enter grade 6 in the fall of 2022 or later are required to take at least one arts course during grades 6 through 12. SLA 6 is another policy amendment on graduation certificates and participation for students with disabilities. This amendment updates the list of courses in social studies that are required for students who are enrolled in the occupational course of study, which leads to a graduation certificate. And finally, SLA 7 is a report to the Jleoc on the impact of lost instructional time. The Office of Learning Recovery has coordinated this complex analysis. While the data itself is not new, we received it last fall, this report goes beyond how many students met grade level proficiency and presents the difference between where we expected students to perform and how they actually performed. The information will help us better understand learning recovery and acceleration programs across the state and to target resources and funding equitably for students and areas of the state that are most in need. This report is due on March 15th, and it includes statewide disaggregated data, but districts and schools will have access to their own data at the district, school, and student level. The Office of Learning Recovery will work with state and local leaders to ensure that the data is useful and actionable, and a final technical report is due in December as more work goes into digging into the data and learning all we can about the reality of our students and what we can do to catch up on some of this lost time. It was very clear that the results that we saw, which were daunting and discouraging in some ways, but that the results were clearly an effect of the pandemic, not of anything that's happening in our classrooms and has been happening over the last 2 years. Finally, a discussion item, SLA 8, is read to achieve the alignment of literacy curriculum and instruction to comply with Senate Bill 387. The board approved the literacy instruction standards in October, and since then staff has completed the remaining deliverables for Section 5. These include creating research-informed practices for each grade band, pre-K through 12, and a model implementation plan and non-model plan to assist local leaders with reviewing and modifying their local plans. Today, we're being asked to approve changes to the pre-K standards that we approved last fall, as well as a form for district leaders to concisely explain their local plans. Finally, we have 5 consent items. SLA 9, Career and Technical Education Credential Attainment Report. This report was presented to the board last month. It includes a variety of data and comparisons based on the credentials earned by North Carolina students last year. SLA 10 is a report to the Jleoc on the Competency-Based Education Comprehensive Strategic Plan. Again, we received this report last month. It outlined progress toward the development of a strategic plan for a competency-based education program that provides credit by demonstrated mastery for students in grades 7 through 12 for credit recovery and acceleration. Finally, SLA 11 and 12 and 13 are all high school accreditation recommendations for Surrey County, Henderson County, and Newton-Conover City Schools respectively. This will be the last month that we consider these recommendations as we await guidance from the working group that Superintendent Truitt is putting together to study our accreditation process. And that completes my report.
Thank you, Ms. Kamnitz. We'll now take a break and return at 10:45. 10:45. No, when you got up, that was a message to me.
Appreciate making time for that, teacher. July. She's behind you. She's July 3rd. I think John and Matt have talked that we might intersect if you're late.
I've been late every time, so.
I think that
You can start thinking
do what we've always done, which is not ever wait on it.
I had a friend who had hurt their baby on.
Yeah, let me just text you.
And they named her Lucy,
Any
they call her Libby.
reason-
But her name is Liberty Bell, yeah.
Because we have to do it on this by March 15th. We don't have to distribute anything.
my child.
Firecracker baby.
Just because you're black, it's talking about white people for
That's exactly right. Let me text
I
you.
started this day and I was like, I can't get any bigger. And then I'm like, well, I gotta try to get bigger. Surely tomorrow I can't get any bigger. Yeah, I gotta get bigger.
She did. Hey, I'm not even gonna jinx this. I'm not even going to jinx this. Let's do it.
We're trying to figure out how the middle schoolers and things.
All right, everyone, we get ready to go live.
I think we should, so we've got, basically trying to do technical questions. Make sure, I don't know.
And I don't think we need to, because we won't put out the application
Yeah,
until they do whatever they're gonna do.
he and Alexis are texting right now, but Jamie doesn't think they're using it.
Mr. Treasurer.
I try to follow here to go live in 1 minute. Let's get a second.
We're back in session and we'll continue with our committee reports, moving to the Education, Innovation, and Charter Schools Committee, chaired by Miss Amy White. Ms. White.
Thank you, Chair Davis. Good morning, everyone. It's my privilege to just review for you the discussion topics yesterday during our committee meetings. EICS 1, we had Dr. Laura Bilbrow-Berry before us proposing the approval of a brand new UNC system lab school. It'll be a partnership between Msa and Guilford County Schools. We're really excited about that. So that's an action on first read. EICS 2 deserves just a little bit more information. Board members, this is going to be the recommendation before us to regarding a 4-month investigation regarding Torchlight Academy. We have heard information during multiple open and closed session, and today we will be presenting a recommendation that the charter agreement between the State Board and Northeast Raleigh Academy doing business as Torchlight Academy be revoked for the following reasons. Reason number 1, violation of laws and regulations, including special education laws and federal conflict of interest and self-dealing regulations. Reason number 2, violations of the charter agreement, including failure to provide requested documents and failure to provide adequate oversight and management of school. Reason number 3, failure to meet generally accepted standards of fiscal management, failure to retain and provide to DPI required documentation of expenditures of state and federal monies, and failure to comply with other fiscal requirements. Reason number 4, allowing the ongoing self-dealing and conflicts of interest by the EMO Torchlight LLC, and a number of different issues that were shared with the board in closed session. This is not a decision that has been made lightly. A thorough investigation from multiple investigators within the Department of Public Instruction presented information to the CSAB and to this board, and the recommendation will be that we terminate the contract charter agreement between us and the and the Northeast Raleigh Academy doing business as Torchlight Academy. I'll pause there. Is there any question today? Thank you. We have 3 items that are on our action agenda today. There is a proposal before us to approve 3 new cooperative innovative high schools. Those are Cabarrus Early College of Health Science, Edge Academy of Health Science, and the Wake Early College of Info and Biotech. EICS 4 is a request by Unity Classical Academy, a charter school, to expand its enrollment because of a facility expansion at their school. They'll be adding students. EICS 5 was the list of renewal recommendations from the Charter School Advisory Committee to the State Board of Education. There were schools that are being requested for a renewal in both the 10-year, the 7-year, and the 3-year. We listed those yesterday, had the opportunity to discuss those. There were none. The item for discussion was EICS 6, and that is the 2021 Charter School application recommendations. After a very diligent period of application, review, interview, in-person interview, we have before us 7 recommendations that have been given for approval. We had the chance to discuss all of those schools yesterday. We'll have another month for us to read through those applications, which are posted on eBoard on the executive summary page. There is also a document posted in eBoard that sort of summarizes. We call them Dave's notes, not Cliff's notes, Dave's notes, for you to have quick finger access, just a quick reference for you to look at those applications. They will be back before us next month for approval. We have multiple consent items. One is EICS 7. This is an restart application approval for Pitt County Schools. EICS 8 is our report to the JLEOC on our Career and College Promise program. EICS 9 was Sugar Creek Charter Schools weighted lottery request, followed up by EICS 10, and that was also a weighted lottery request by Thomas Jefferson Classical Academy. EICS 11 is also a report to the Joint Legislative Oversight Committee on our virtual charter school enrollment. EICS 12, we had a Tiller School to request an amendment to both its vision and its mission statement, and we concluded our work yesterday with a final report to the JLEOC on dual enrollment and opportunity study. Are there any questions about any of the items on the EICS agenda today? Mr. Chair, I turn it back over to you.
Thank you, Ms. White. I now turn to Mr. Reginald Keenan, Chair of the Healthy Responsible Students Committee. Mr. Keenan.
Thank you, Mr. Chair. I'm Reginald Keenan, along with Alan Duncan. We bring to you one action item. And yesterday, Dr. Taylor and Ms. Furley thoroughly talked about the consolidated data report that we must, of course, annually present to the General Assembly. As you know, there's a lot of information in regarding that particular report, but some of the highlights were kind of stand out as the fact that there are a lot to be done. There's a lot of kids that we must continue to pay special attention to. As we know that the health and well-being of kids are so important, and that's why wraparound services, we got to continue to do all we can to make sure the children get what they do need. Also was pointed out, Mr. Ford, that also when we suspend kids, we need to make sure that we have some type of measure to make sure that kids are suspended under a uniformity type situation rather than subjected, because sometimes you come subjected can cause sometimes not to be treated fairly as to a certain matter. So, Mr. Chair, a lot of work to be done. Ms. Furley, Dr. Taylor doing a great job and the great work they're doing, and I thank them in the committee. And with that, Mr. Chair, that concludes my presentation.
Thank you, Mr. Keenan. Any questions on the Healthy Responsible Students Committee report? Hearing none, I'll turn to Dr. Olivia Oxendine, Chair of the Educator Standards and Practice Committee. Dr. Oxendine.
Thank you, Chair Davis. This is Olivia Oxendine. I chair the Esmp, and joining me in that responsibility is Ms. Amy White. Coming to the board today, I'm going to do a quick summary of the items that were discussed in yesterday's meeting. The first of two new business items pertains to GS 115C 269.010. This is the statement whereby the State Board of Education is the body that authorizes EPPs to operate in North Carolina, and we do so by doing the initial authorization. So coming to us this month is information about the North Carolina community college system wishes to become an EPP in North Carolina. So this is just information about the fact that they have made this request, and I would imagine in the very near future, we will be looking at individual campuses who want to take part in this, to function in North Carolina as an EPP. The next item pertains to the limited license update, and it was presented by Dr. Tomberlin. In kind of just a thumbnail on that presentation, there's reason to be concerned. We have a growing number of candidates who, in their programs, their EPP programs, their programs of study, without passing the State Board of Education licensing exams, but they are given the opportunity through what is called a limited license request that is made by the superintendent along with the principal to work for 3 years on this limited license. There are restrictions around it in terms of the teacher can only work within that district. The other requirement is that the test be taken one time, the exam be attempted one time in that 3-year window. So this information I felt was necessary for not just the board, but the general public. And the positive thing that will come out of this, I hope, is just a closer partnership between our EPPs and our school districts so that everyone can do what is necessary to prepare the teachers and get them in a position where they're going to be the very best possible teacher, educator that can be for our students in North Carolina. For action, ESNP 1 pertains to LICN 002, routes to licensure, the licensing pathway for preschool teachers. With the end of lateral entry in North Carolina, the question remains, what about our pre-K teachers? So a pre-K teacher can receive a license, request that license from the department from DPI. However, the license must be maintained by the Department of Child Development and Early Education. The other requirement is that the Department of Child Development and Early Education, the other requirement is that that division or that department establish and maintain a beginning teachers program. The other item that we will vote on today is ESNP 2. It's in the Teacher Education 004 category of the policy manual. This pertains to the recognition of an EPP, and this one is specifically the University of Phoenix. So we've done quite a bit of work around this item, talking on 2 occasions, meeting virtually with the officials of the school, the College of Education. We feel very strongly that they're ready to function in North Carolina as an EPP. They are going to also require the same exams that we require of completers in our North Carolina and our UNC system, as well as our independent universities. So we're very pleased to add the University of Phoenix to our community of EPPs. Under discussion, Esmp 3, this was presented by Dr. Seiberg and Baxter, and this item brought us up to date on the Educator Preparation Performance Report. The recommendations are also provided to the public in a link, the dashboard link, which opened yesterday. So in a nutshell, from that report, it seems as though admissions, good news, gains are very evident in the area of admissions, completers rather, candidate proficiency, student growth, satisfaction categories. In those categories are the candidate as well as the employer, teacher performance, and student growth. So that's a good news report. The dashboard where the data are available to the public, as I just said a minute ago, is now available. Plans for continued improvement on that dashboard were noted, and those improvements are to incorporate narrative responses, probably from the candidates as well as the employers. The use of dashboard across all areas of human capital, that is for future consideration and improvement. I think that's a great idea. So the dashboarding technology, in other words, would not just be restricted to this report, but across all of human capital, and strive for greater increased granularity. The next item was presented by Dr. Evans, Esmp 4 policy amendment in the category of LINC 001. This is general licensure requirements, as well as the lifetime license. And the lifetime license is covered in GS 115C-270. And more specific information around that, the regulations for, the changes were made in the area of CTE. So the removal of the CTE endorsements to the area of CTE licensure areas. And requirements for the lifetime license, 30 years of credible service with the teacher and state employee's retirement system. The teacher must have completed 30 or more years of employment as a teacher or in the area of student services in one or more of our PSUs in North Carolina, and must be currently licensed teacher, administrator, student personnel, no expired license, and if that license is expired, it must be renewed using the procedures and the processes for retirees. Esmp 5, LINC 006, experience degree credit for salary purposes, year of credit for the MSA intern and master's pay. So specifically, in order to get that 1 year of experience, I'm going to talk about the MSA intern first. The intern must be enrolled in an approved EPP and must be a full-time intern, receive state pay stipend or a stipend from another source. Number 3, completes a 10-month internship or a combination of the internship and 1 academic year, or a combination of the internship and employment that satisfies the 6-month requirement for work experience. In the category, the other portion of this item dealing with graduate pay, for teachers, student services personnel who complete a degree at the advanced level, and the advanced level could be the 6-year program, of course, a master's degree or a doctoral degree. They must have completed at least 1 course toward the degree prior to August 1, 2013, and qualified for the supplement pursuant to LICN 006 as it was in effect on June 30, 2013. Esmp 6 pertains to the revised licensure requirements for school administrators. As we know, we have a waiver in process that's coming out of Session Law 2021, 170, and it's Senate Bill 695. And this waiver is protecting those seeking the school administrator's license presently and those who have earned that license since 2011. For several months, the State Board of Education, we've received several updates from Dr. Seiberg and Dr. Tomberlin, and those updates have included a range of recommendations from 3 groups: the teacher recruitment and retention, in CAPTE, and most recently from Pepsi. And these recommendations are as follows: to discontinue the exam for school administrators, to require a performance-based assessment as part of a portfolio, to require the master's in school administration or a master's degree in another area, counseling, for instance, or school social work. And I think yesterday Ms. White mentioned maybe a master's degree in the area of finance. For the MSA, for the non-MSA candidate, require the add-on pathway. And that could include up to 24 hours of additional education preparation, graduate study in the area of school administration. Courses such as curriculum, school finance, school-based management, ethics, law, those courses. And the other recommendation, a minimum of 500 hours for the internship. The duration and the requirements could vary. And as I said yesterday, my recommendation would have been to set that minimum at 750 hours. Well, that could be done, I suppose that could be done by an EPP. The duration and the requirements would depend on the candidate's need in terms of preparation. And also the 4 years, the last of the recommendations, the candidate must have 4 years of experience in the licensure area for certified school personnel. I want to add just a note under the removal of the licensing exam. I did a bit of just quick research a few days ago, and I found this to be the case. It took me probably no more than 30 minutes to go online and do this quick, very cursory kind of research piece. I found out we have 39 states that require a licensure exam. We have 10 states that do not require a licensure exam, but they do require at least 2 to 5 years of teaching, classroom teaching. So I just found that to be interesting, and I wanted to make note of that. And then the last item, Esmp 7, the state of the teaching profession. This is a report that's going over to the JLEOC. It was presented by Dr. Tomberlin. And just kind of a quick overview of this report. In the area of attrition, and I'm going to talk about from 2017 and also compare that to 2021. In the area of attrition, in 2017, the attrition rate was 8.909. The attrition rate today, in 2021, is 8.20. In the area of mobility, in 2017, the rate was 4.37, and mobility in 2021, the rate was 2,069.69. We have a total overall since 2017, according to the report, the total number of teachers in North Carolina remain at about 94,000. So that concludes, unless we have questions or comments from the audience, that concludes my report.
Thank you, Dr. Oxendine. Any questions on the Educator Standards and Practice Committee report? Hearing none, I'll turn to Vice Chair Duncan, Chair of the Business Operations Committee. Vice Chair Duncan.
Thank you, Chair Davis. On behalf of the Business Operations Committee, we had several items for actions on first read. Our first area was Biz Op 1, which is contracts over $500,000. I think all of you will recall how we arduously worked through all of these contracts yesterday. A couple of oversight matters. You'll note it as we went through yesterday, we identified those contracts where the amount and the vendor was identified in the legislation. And in other instances where it was not, we identified where there was a bidding process that would take place. And in all of these, identified the amount for what the allocation was. So I'm not going to do that again as we go through this report. But very quickly, Dr. Cynthia Martin introduced the first 3 contracts. They're all in the area of supporting district and regional support, in particular our schools with the greatest challenges and greatest need for leadership, because leadership development is the focus of all of these contracts. The first one is the North Carolina Alliance for School Leadership Development. The second contract that she described was the Relay Graduate School of Education. And the last one is the Schools That Lead contract, all of which are focused on developing leaders in our respective districts around the state through the support group that we have established to assist these schools on behalf of DPI under the leadership of Dr. Edmonds and Dr. Martin. Our next contract was presented by Dr. Lori Carlin, which is the Beta Box contract. That is a STEM contract for an educational aid for students in the STEM area. Next contract is actually with communities and schools of North Carolina. This is an additional $3.9 million from the Essa funds, and all of these are from Essa funds. All of these contracts are. Ms. Susan Brigman presented on this. There are 15 communities and schools around the state, and this $3.9 million will be distributed to those communities and schools organizations around the state, and that will be in addition to what the regular legislative allocation has been for communities and schools. Our next presenter was Mr. Kevin Harrison, and he presented 2 contracts, one with White and one with Thomas Built Buses, for the production of a total of 5 electric school buses that will full-size buses that take the same number of students. They go to 5 different counties around the state they were the 5 that made application for them. The money for this comes from the Volkswagen settlement, you recall, but it was a significant class action a few years ago, and that's the money that supports these purchases. Had a very informative discussion about about electrical buses and issues that distinguish them from diesel and the infrastructure involved. Also, we took this opportunity for Mr. Harrison to report about gas price issues, which is important to communities around the state, with both the presently escalating prices and the uncertainty that's been created with the conflict in Ukraine. He gave us a status report on where things are, and literally changing by the day, as I think it had gone up 20 cents yesterday from the day before. So, and I believe we might have added to that again this morning. So it is truly a fast developing situation. Right now, the amount that's distributed, which was upped from $2.09, I think it was $2.09 to $2.29, will need to be upped further during the course of the year. And there's sort of 3 options. 2 of them are legislative assistance. The third would be the local communities would have to come up with the additional funding. Hopefully, this is something that we'll stay in very close contact with our legislature and work with the legislators to keep them fully apprised of these issues so that we can be good reporters to support all of our local districts who are dealing with this very difficult issue. And some of the most impactful ones are some of our rural communities have some of the longest bus routes because of the size of the communities, and they're not necessarily communities that could readily absorb significant losses from the increased gas prices. So we do need to keep a careful eye on this on behalf of our various communities around the state. And I appreciate the report Mr. Harrison gave, as I know we all did. Our next 2 contracts were presented by Mike Ramsey, the Director of School Connectivity. The 2 contracts were, one, a DLT CrowdStrike contract, and the second was an Accenture amendment. Both of these contracts are in the area, and they were described in some detail by Mr. Ramsey. They're in the area of cybersecurity, and the intention is to implement these contracts on an ongoing basis the Accenture contract being a continuation of a contract we already had with Accenture, in order to increase and continue to increase and upgrade our defenses from a cybersecurity standpoint. This is important to the state and to our schools, as we like so many entities, are having to deal with these cybersecurity issues, and there's a concern that they may increase. So we need to be particularly alert and attentive to this issue. Next, Dr. Rob Dietrich, who is our Director of Digital Teaching and Learning, made presentations on 3 different contracts. First one was Contract Amendment 2 for the Digital Supplemental Math Solution, which is Imagine Math program. And he described how that program is used and implemented and the platforms from which it is used. Contract Amendment 5, the second contract covered by Dr. Dietrich, was for North Carolina's Open Education Resources Platform, and it's through the Institute for Study of Knowledge Management in Education. This OER platform has got significant North Carolina sourcing and North Carolina oversight, and has been well used and effectively used by teachers throughout North Carolina as a resource for materials that are beneficial to their classroom teaching. The third amendment is a Contract Amendment 1 for K-8 Digital Literacy Learning.com. So again, Dr. Dietrich described how this program is assisting our literacy efforts throughout the state. And this is a continuation of a contract, with this being another amendment to it. Our next presenter was Dr. Angie Mullinex, our Director of Innovative Programs and Practices, and she brought to us the NROC project. And you may recall we've had the NROC project in place, and then it was paused for a period of time because of funding. But now it has been funded again through the Essa allocations, so the NROC project is going to go back into place. And Dr. Mullinex, I think, did a very effective job of telling us where it is used and how it is very helpful to certain populations around our state. Our next presentation was by Mr. Trey Michael, our Director of CTE, who presented the Scholar Path program. And this is a CTE program that, importantly, and this was highlighted by some of the discussion that was had with board members, covers the period from elementary school all the way through the end of high school in terms of enticing and providing support for CTE educational opportunities for all of our students. A special emphasis was placed on the board on the need to get students involved in the CTE programs before high school and in middle school and earlier, in order that students have the proper background and basis when they get to high school to focus on it, and also have some idea what they might be interested in if that is a path that they want to pursue. Our next presenter was Dr. Lynn Barber, Executive Director in the Office of Learning Recovery, and she presented on the innovation projects, often called shorthanded as TIP. It's a $4 million contract, and this is for innovative processes around the state and our school districts. There are, not all of our school districts are members of it, but many are, and this is funded for $4 million for the period through through the end of Essa in September of 2024. And it supports the work done by the Innovation Project, which has been already active and already funded. It also has some other funders aside from the state. There are a number of foundations, at least one I know of, that are significantly involved in funding. So it is supported by the state and community, if you will, as well as in this case by funding from Essa. The last presentation we had was from Dr. Matt Hoskins, Assistant Director for Exceptional Children Division. This was the Beginnings outreach for parents of children who are deaf or hard of hearing. This is approximately $1 million platform that's going to provide great assistance for our Exceptional Children's Division in working with our students who have hearing issues, all the way from hard of hearing to deafness. So that's a summary of BizOp 1. I tried to talk fast, but probably not fast enough for everybody. BizOp 2. BizOp 2 is also ESSER funding. It's ESSER 3 funding, and these are the allocations as opposed to contracts. And there's discussion about the allocations into the PRC categories. The first one was Summer Career Accelerator Program in PRC 188. This is a $36 million allocation, and is to distribute funds to support the public school units addressing COVID-19 related needs during the summer. The second one we have is the Math Enrichment Program, which again is a $36 million allocation, PRC 189. And this is to distribute funds to support public school units in addressing COVID-19 related needs during the instructional year, not during the summer, and focused obviously on math through after school and before school programs that incorporate supplemental in-person instruction as well as other instruction in the area of math in grades 4 through 8. I think we all, through other reports we received at our meeting, lamented the the learning loss that's occurred for our students. And rightfully, we're very focused on literacy as such an important thing, and noted the losses that occurred there. But it's important to note that our losses were even more severe, learning loss in math in most grades. And so this is an important supplement, if you will, to assist our students in getting back on track in math. And that's, as we saw from the data, that's not going to happen overnight. That requires a continuous effort. This is part of the support of that continuous effort over the next 2.5 years. Our next item was grants for identification and location of missing students, PRC 191. It's a $7.2 million grant approximately. It drew a good bit of discussion, which was starting with the definition of missing. And so I appreciate that Dr. Dietrich in presenting this particular item to us. Ms. Catherine Clark was the main presenter, but Dr. Dietrich gave some additional information with respect to how we best try to define missing in this context. It was noteworthy that approximately half of our PSUs statewide would not receive any funds from this because fortunately they don't have any students who would be categorized as we are seeking to define it as missing. But a number of our districts do, the other half, and I said districts, the other half of our PSUs do. The allocations are made up to the amounts that are available pursuant to a funding formula that was described by Ms. Clark, and it's focused on the numbers of students about whom we need to see if we can regain contact. It's important to note as we cover this one that missing is not necessarily a good word to use here because the students are not necessarily missing, it's just they're not clearly identified as to their location now. And that can be during the pandemic, when you've gone to a new school, the information sometimes doesn't get back to the old school as quickly. You may have moved out of state. Their procedures for providing the information are different. So the effort, however, by the General Assembly is to assist here in trying to bring about additional information so that we can try to feel secure about where the students are as best as is possible. This requires third-party contracting by those districts who receive distribution of funds. It's not money that can be used within the district or within the PSU to continue their efforts. There was a very good discussion that was had on that. Our next item was career and technical education for a hospitality program for $400,000, and that was something that gives our PSUs the opportunity to provide options for students outside traditional classroom instruction with a focus on developing the skills needed in the area of hospitality sector. Then we had the district and school turnaround grants for a total of $5 million, and we had a presentation about how that would be used to support performing schools in our low performing status in implementing flexible improvement and intervention options. Through the formula that was developed, a total of 68 schools of our 480 low-performing schools would receive significant assistance. And we rejoice in that and still worry very much about the remaining 418 schools that would not be receiving assistance from this, but we need to make sure we're providing assistance from other sources. PRC 197 was middle school reading, and this is specified by statute to a certain number of certain identified PSUs. And so this allotment was set out consistent with the legislature, and that we would have before us then to go ahead and proceed to pass that allotment proposal, which is PRC 197. And finally, PRC 205, we had already approved the distribution for driving training. This is a modification of the policy just to provide a different allotment model from what we originally approved. All right, BizOp 3. This is a report to the Joint Legislative Oversight Committee for Education and Workforce Innovation Commission that we commonly refer to as EWIC. Ms. Jacqueline Wyatt, our Career Readiness Specialist in Career and Training in Career and Technical Education, provided this report and described the developments that have taken place over the past year and provided a copy of the report for us to review so that we would be fully familiar with the developments that are occurring despite the pandemic, and that will be provided to, we will be approving that to be provided to the legislature. BizOp 4 is a piece of good news in the struggle on the nutrition area. It's the USDA Supply Chain Assistance Funds to support local school nutrition program operations of $28.3 million, actually almost $28.4 million in federal funds. This is intended to supplement and support through local vendors the needs of districts, because there has been a great deal of disruption in supply chain over the course of the past several months for our school meals program. This is going to be very helpful to a number of districts, and so you have the allocations for what each district will receive. That's formula-based from the federal government, but it's, again, a piece of good news. BizOp 5 is the ESSER 3 budget considerations for use of administration funds. Ms. Schaus presented this item and gave us a little bit of an overview of the overlap of the funds and what's done with the funds once you make some of the primary allocations, and again, what are the administrative funds and what allocations can be made there. Presentation was made that these administrative funds would be used in, I believe, 4 different areas to support initiatives in the administrative area of the work during this recovery from the pandemic. And it also included purchasing licenses for certain things that are needed for communications purposes within the department and to communicate effectively outside the department and to the constituency. BizOp 6 is a school business systems modernization annual report and update. This is again a report that's being presented and recommended for approval. It's required. Dr. Vanessa Wren, our Chief Information Officer, and Mr. Barry Pace, who we welcomed as our Director of Modernization, having joined the agency the 1st of February, or rejoined, I should say. He came back. And this report gave us information about where the school business modernization program sits, work that's being done, and the challenges that exist in getting this accomplished. BizOp 7, State Reserve Funds for transporting students experiencing homelessness and in foster care. Very fortunate to have Ms. Lisa Phillips and Ms. Sarah Bigley here, who are our state coordinators. Ms. Phillips for homeless children and youth, and Ms. Bigley for agency foster care point of contact. And they provide a report on some federal funding that has been provided and how it will be distributed. Not every district has the need for this funding for transportation, but there are many districts that do, and it will be allocated proportionally within the districts that have the need. It will not cover all of the additional transportation costs, but it will be of great assistance to the districts who have this. We're serving these homeless children and these children who are under agency foster care. We're very grateful for the work that both of these coordinators do for these children. BizOp 8 is the first of our consent items. Ms. Neha Shaw Coltrane gave us a brief report with respect to our annual report to the Jleoc on advanced placement and international baccalaureate bonuses. I think the report covered the amounts and also where we are, despite the pandemic, where we are in terms of number of teachers who are still earning these bonuses. BizOp 9 is the Jleoc report for credential bonuses for CTE. You recall that was presented last month by Nancy Cross, so it's a consent agenda item this month for us today. BizOp 10 is certification of 2 new finance officers. Our monthly budget report, we did not go in the detail we have in light of the many other reports we had this month, so we did not have one of our smaller pieces included. We did not have a personnel report this month. We have a new personnel director who just arrived and who we welcome, and we look forward to meeting next month at our meeting. Finally, we had our implementation report with respect to CARES Act funds and ESSER 1, 2, and 3 funds. Dr. Cynthia Martin, Dr. Marr presented and introduced this item. Then Dr. Cynthia Martin provided the school leadership initiatives, a report on that and what's being done with the ESSER funds to date and the progress that's being made. Dr. Jenny Korn reported on research areas and made an interesting presentation in the sense that we hear a lot about quantitative data, and we've gotten a lot of information about quantitative data, but now we have more information through a report that was presented to another committee with respect to what was the effect of the pandemic. And so we don't have, we have not had up until this time any qualitative research data, and this report was about how funding that we approved is going to be used to develop qualitative data throughout the state. 4 of our university system colleagues and partners will be covering the 8 districts in the state, and we'll be able to provide a lot of qualitative data from various sources from the various communities that they will be visiting. That will put more meaning to the quantitative data and frankly help put it in context for us in some instances. So it was an important discussion about what qualitative data is and how we're going to be able to use it in conjunction with quantitative data. And I would point out that she also introduced our new qualitative data expert that has joined us on the Office of Learning and Recovery. So with that, I'm finished, and thank you again for your patience.
Thank you, Vice Chair Duncan. Colleagues, that concludes our committee reports. I have to comment and compliment not only our board committees, but particularly our staff for the volume and quality of work that's produced every month. It may not surprise you, but it numbers in the thousands of pages of materials to document the terrific work that staff is doing and materials that board members spend considerable time and attention reviewing, sleepless nights thinking about, I'm sure, and other activities. It's just remarkable the amount of work that's done on a daily basis on behalf of our students. So my appreciation to each one of you for contributing to all that effort. We now move to the chairman's report, and I do have 2 items for action under that report. I'm going to need our general counsel to be back, so let me pause for just a moment.
Mr. Chair.
Yes, Ms. White.
While we are waiting on them to be back in the room, could I have a moment of personal privilege to just say to our social studies educators in the area close to Wake County, the Vietnam Wall That Heals replica is coming to Wake County, to Lake Benson Park at the end of this month, Thursday the 31st of March through Sunday the 3rd. It's an incredible opportunity for students in our area to see that wall. It is a 3/4 scale replica. It comes along with a mobile education center, and so for schools that are interested in making field trips, it's not too late to schedule a time to bring students over to see that incredibly impactful monument representing the names of 58,276 men and women who made the ultimate sacrifice in Vietnam. Thanks for letting me share that.
Thank you for sharing that, Ms. White. Any expression that brings us together and gratitude for our forebear service is to be appreciated, so thank you so much. Colleagues, we do have 2 items for action under the chairman's report. The first deals with proposed memoranda of understanding and rule changes for interscholastic middle and high school athletics. And I'll turn to our general counsel, Ms. Allison Schaefer. Ms. Schaefer.
Good morning, board members and members of the public and Madam Superintendent. We, as you know, we have been working since May with legislative issues and drafting memorandums of understanding to address concerns or issues that have arisen with regard to the conduct of high school athletics. In November, there was a state law passed that required us to enter into a memorandum of understanding with those entities that govern high school athletics, and our deadline is March 15th. So we have been working on those with 2 different organizations. The largest of those is the North Carolina High School Athletic Association, and then also there's a smaller organization that represents or works with charter schools. It's called the Carolina Athletic Association for Schools of Choice. We have negotiated with them and have draft memoranda for the board's approval that will meet the March 15 deadline, and we believe those have, we have spent a lot of time and energy working with the associations to make sure that we get the best deal for the students. There was also an amendment to the rule that has been proposed as a temporary rule. Last month, the board passed a proposed rule. There are some technical changes in the new rule to address some issues that have been raised, basically requirements of the Rules Review Commission and some things like that. So we would ask that the board pass both the amendment to the rule and the two MOUs, that those be accepted, and that's all I have. Thank you.
Thank you, Ms. Schaefer. Any questions for Ms. Schaefer on this item? Well, Ms. Schaefer, I just want to express to you my gratitude to you and your staff for the tremendous work. This has been a mountain of work to get done in a short period of time. Difficult issues, and we appreciate your work and also the cooperation of the associations and the partnership with legislators who worked with us on this endeavor. I think it will create an even better opportunity for our students to participate in athletics.
And you failed to mention that there are board members that have spent a lot of time too, including and especially Vice Chair Duncan, who has been part of the negotiating team, as well as Wendell Hall and you, Mr. Chair, have spent a lot of your personal time invested in all of this. So it's been a joint effort, and thank you, and I'm glad we were able to get a satisfactory conclusion.
Likewise. Thank you. Mr. Hall.
Mr. Chairman, if I can quickly, I just want to cross the ditto your comments, but to the legal staff, my voice is not loud enough. To the legal staff, Counselor Schaefer and all others, I don't think anyone knows the work, the time that these folk put into putting this MOU together and the time frame that we were working under. I consider you now as a member of that team. I didn't think we were going to get there. I didn't. I thought time would catch up to us and we would not get there, not because of anybody not wanting to collaborate. It was just the timing and the complexity of the items that had to be in there. And I just want to thank Councilor Schaefer today and his staff. A job well done. I wish we could bundle them up and put them on a plane and send them overseas to that mess that's going on, and I believe that they could come up with some kind of agreement between Russia and Ukraine. And I say that, and I know in jest, but those folks did a heck of a job. And I'll let my flavor of comments rest with that.
Thank you, Mr. Hall. We'll just stick to high school athletics for now. We appreciate your sentiment. Any other comments on that item? Very good. Our next action on first reading concerns proposed change to the State Board meeting schedule for this year. And I'll turn to our Director of Board Operations and Policy, Dr. Deanna Townsend-Smith, for this item.
Good morning, Chair Davis, Vice Chair Duncan, Superintendent Truitt, and respected members of the board. State Board Policy 006, Section 5.6, governs your planning and work sessions each year. So it notes that twice a year you will conduct a planning and work session. You are supposed to have one on May 3rd through 5th. And given the current transition, I propose that you suspend your rules for that meeting and have a regular meeting, and for that meeting to be May 4th through 5th to allow for appropriate planning in the background, and approve a calendar change for proper notice for May 4th through 5th, 2022.
Thank you, Dr. Townsend-Smith. Any questions on this item? Okay, hearing none, that will be before us in just a moment. I also have 3 items of new business to announce. As we're all aware, following our February meeting, we learned that our very own Dr. Deanna Townsend-Smith had accepted an offer to become the Executive Director of the Dudley Flood Center. And while selfishly I wish otherwise, there is no one, absolutely no one, better to lead the Dudley Flood Center than Dr. Townsend Smith. Rest assured, in the coming days, we will more formally celebrate Deanna and express our gratitude for all she's done for our students. And at this time, would you like to make a few remarks, Dr. Townsend Smith?
So I'm going to stay true to form and be brief, but I'm going to begin with thank you and end with a charge. So serving this board, my colleagues, and many of you who are now my family and friends, the public schools, and its 1.5 million children has been a true pleasure. My hope is that you have seen and experienced my heart and passion for education. And I believe firmly that education is the foundation, the bedrock for any other profession to come. We must protect and support every educator so that they have what they need to support the academic and non-academic needs for the students they pour into each and every day. As each of you continue to lead in your respective roles, I challenge you to remember the importance of opportunity and access. Equity is central to meeting the needs of each and every student. You have a path through 2025 that must be maintained to meet the basics of a sound basic education, that constitutional promise that is projected behind you each and every meeting. While you will need partners to help you reach the established goals, you must maintain the standard of equity and excellence. My life's mission is to serve, transform, empower, and inspire. As I leave this role, but not this mission, I leave a little part of me here with the hope that you will continue the necessary work, as our students deserve no less. It has been my honor, pleasure, and privilege to help chart the course. I thank you for an amazing and unforgettable opportunity. Through multiple hurricanes, a pandemic, literally and figuratively, we have proven that the best innovations and results happen when we remember that what is best for the least of these helps to support the needs of each and every. So thank you again for this opportunity and for allowing me to serve. Thank you.
Thank you so much. Our next item is another announcement concerning this role. After a thorough search, I'm pleased to announce that the next State Board Director of Operations and Policy is Dr. Maria Petrie-Martin. A two-time superintendent, Dr. Petrie-Martin brings a wealth of experience, a complete devotion to our students, and a deep understanding of North Carolina, the department, and the board. We look forward to her joining us in a few weeks to take on these responsibilities, and I believe she is online now.
Good morning to everyone.
Good morning.
Good morning. Hopefully you can hear me, and I just want to say I'm very honored to take on this role. I have big shoes to fill in Dr. Townsend Smith, and I'm also so honored and appreciative to be coming back to North Carolina. So thank you all, and I look forward to this opportunity.
Thank you, Dr. Petrie-Martin. All right, and our final new business item is I want to thank my colleague, Mr. Wendell Hall, who currently serves as the chair of the Government and Community Affairs Committee, and also serves as our liaison for the North Carolina High School Association, which has been quite busy recently. But he's agreed to take on two additional roles. That is to serve as our liaison for the North Carolina Education Corps and the important work happening there, as well as to serve as Vice Chair of the Business Systems Operations Committee, which I know Mr. Duncan is thrilled to have you on board to share some of that load.
Here, here.
So, Mr. Hall, we appreciate you taking on those responsibilities in addition to what you're already doing and lending your considerable expertise to this work. Okay. So that concludes our new business items. Board members will now vote on any item requiring action from your committee reports. A thorough discussion and report was provided on each item, including any respective consent items. And as a reminder, any item on the consent agenda is primarily not complex and may have come to the board for discussion in a prior month. I note also that we've seen these consent agenda items for at least a week. At this time, I ask if there's a request to remove any item from the consent, action, or action on first reading agendas. Hearing none, I now request a motion to approve the following: the February 2nd and 3rd, 2022 meeting minutes, SLA 1 through 7 and 9 through 13, EICS 1 through 5 and 7 through 13, HRS 1, BizOp 1 through 10, and Esmp 1 and 2, the memoranda of understanding and proposed rule changes for interscholastic middle and high school athletics, and changes to the State Board of Education 2022 meeting calendar as presented today, IPL and ILT licensure approvals, and the ISD hire recommendations as discussed in closed session last evening, and the adoption of the Strong Schools Toolkit as presented in this meeting. Is there a motion to that effect?
Treasurer Falwell makes that motion.
Motion by the treasurer. Is there a second?
Second.
Second by Ms. Kamnitz. Any discussion on this motion? Hearing none, Dr. Townsend Smith, will you call the roll to capture the vote?
Yes, sir. Dr. Oxendine?
Yes.
Ms. Kamnitz?
Yes.
Mr. Keenan?
Yes.
Mr. Hall?
Yes.
Dr. Tipton Rogers?
Yes.
Ms. White?
Yes.
Mr. Ford?
Yes.
Treasurer Falwell?
Yes.
Lieutenant Governor?
No.
Vice Chair Duncan?
Yes.
Chair Davis?
Yes. Motion carries. This concludes our agenda for the March 3rd, 2022 meeting. Colleagues, I would just remind us all, as noted yesterday, we discussed how critical our public schools are to our democracy, our society, and our economic stability. I charge us to work diligently to provide the necessary resources to sustain this system, which provides so much for each of the communities that we live in. And as we prepare for the next short session, let's make sure we deliver the policy changes and initiatives that are so critical to meet the needs of our public school students, their families, and their educators. We know what's necessary to give our students the education they need. Now's the time to work together to achieve that common goal. Our students' future and our state's future depends on us. I now request a motion to adjourn. Motion by Mr. Hall. Is there a second? Second by Ms. White. Dr. Townsend Smith.
Yes, sir. Dr. Oxendine?
Yes.
Ms. Kamnitz?
Yes.
Mr. Keenan?
Yes.
Mr. Hall?
Yes.
Dr. Tipton Rogers?
Yes.
Ms. White?
Yes.
Mr. Ford?
Yes.
Treasurer Falwell?
Yes.
Lieutenant Governor? Lieutenant Governor? Vice Chair Duncan?
Yes.
Chair Davis?
Yes, motion carries. We stand adjourned. Have a good day.
Right.